Hello everyone, welcome back to my YouTube channel and thank you for your support on my previous video. Today on this video I'll be speaking about the prescription, the Australian prescription, how does it looks like and what are the key important things on the prescription. And if you are working on the pharmacy setting or if you are the normal person also, this video might be helpful for them too, because sometimes there are some of the details that is missing on the prescription. You can check your prescription yourself, and if there is something missing you can let your doctor know about that. The prescription that is with me is actually for myself, but I have closed all the important details, like the patient name, address, and the prescriber number. That I think it might not be good idea to enclose all those things on the video. Okay, for the confidential issues too, but it should be fine with me because it is for me. But also on that case also I don't want to disclose all the details. Okay, and with this one at first we'll go through one by one on the details with the prescription. Okay, if I come close to this one at first, as I mentioned on my previous video, there are two parts on the prescription. Always you can see this is the fresh prescription. One is the over here you can see the Medicare copy, and another part is the pharmacist copy. Okay, pharmacist copy you can see clearly over here. In both the copies has the same information on both the pages, and I'll say like why you need the both the copies. Sometimes like patient will come just clearing one copy and they'll just come with the one copy which is not valid. Okay, first thing remember, for the prescription, if you are working on the pharmacy setting or if you are the normal people who is going to the pharmacy with the prescription, you need the two copies of this one. Okay, don't bring just one copy, there should be two copies. Okay, and starting from the details, at first you will see the doctor name, doctor working place, and address, doctor name, address, and you will see the phone details, everything over here on the top. Okay, and if you come down you will see the prescriber number. Okay, remember, if you are the intern pharmacist or the pharmacist working on the pharmacy setting, the hospital setting too, I'm not quite sure with the hospital setting, you might see many of the prescription, mainly in the hospital one you can see the prescriber number is missing. Okay, so if you are the intern pharmacy just learning in the pharmacy and it is you are newly one, just remember there should be the prescriber number on the both the copies of the script. Okay, or the prescription, there should be the prescriber number. Remember this thing. Okay, in moving downward you can see the patient Medicare number or the pharmaceutical benefit entitlement number. Okay, if the person have the Medicare, they will have the Medicare number over here. Since I don't have the Medicare number on this one. Okay, and moving downward, it is the concession card. If someone has the concession card like a healthcare card, there are the different type of the healthcare card. I'll make a separate video on that topic too, so stick on my video. Okay, for the future too. And if they have that one, it will be written over here. Okay, in this place. And moving downward, there is the patient name, address, and there is the date downside. Okay, if you see the patient name, I don't want to enclose all the details, so I have covered that one. And downward you can see the address. Okay, after the prescriber detail, prescriber number, the main next important thing that many of the prescription will miss is the date of birth. Okay, and some of the medication they need the date of birth, like for the S8 schedule 8, and like a control drug or the drug with the drowsiness. Because with the drowsiness drug we need to check on the script check, so we need to check further, so they also need the date of birth. So on if you are the intern again and you are on the pharmacy setting or the pharmacist, again if you can't see any date of birth and it has the medication, like a control drug or any medication that makes the drowsiness, that you need to check on the script check. If you don't have the details, there are a few ways you can confirm with them. If they have their ID, you can confirm with the patient itself, because if all the information is correct, you can confirm with them. Second thing, you can confirm with the prescriber, because that is the legal requirement in the prescription. Okay, remember it the date of birth, if there is the acid medication or it is the S4 or D, then there is the legal requirement. You need to have the date of birth, you need to have all the information on the prescription. Okay, and going forward, and after that, let's go on the date. That should be the prescription date. And also with the hospital prescription, I have seen many of the prescription don't have the prescriber number, they don't have the date either in many of the prescription. In first or the faulty one, and the scammed one, sometimes the people just pretend to bring, they sometimes steal the prescription, and sometimes they write themselves and they don't put all the details. For those, you can confirm with the prescriber. Okay, but remember those things, there should be that details too. Okay, and moving downward, there is a bottom, you can see the box saying brand substitution not permitted. That means if doctor has highlighted that one or crossed on that one, that means if doctor has written a particular brand, otherwise doctor has written a medication with a brand, you can't change to another brand until and unless it is approved by the patient. You can get the thought of the patient, but best is if it is like crossed. Speaking about the brand substitution, for example, doctor has written the candy saturn, that is the blood pressure medication, and doctor has written brand substitution not permitted, and in the bracket he has written the etacan. Then you need to give the patient etacan unless, until and unless you confirm with the doctor. Okay, that is the brand substitution not permitted. That means they can't have the generic brand, because sometimes patient might have allergy to some of the ingredient that is used on the generic one, because generic and the original brand and the non-generic brand have the difference with just some of the component, not the actual component, some of the fillers or the diluents or any other things. Okay, so if there is something like brand substitution not permitted, that means you can't change to another brand until and unless you confirm with the patient, either with the doctor. I'll say best is confirming with the doctor, because doctor is aware of the allergic reaction and all the things that patient is aware about. Okay, again moving downwards, here is the, since I don't have the Medicare and this medication is not covered, it is written here non-PBS. That is, it won't be substituted by the government for me. Okay, I'll make the separate video on the PBS, non-PBS, Medicare, all those things on the coming future. For now, just remember that since I don't have the Medicare, and sometimes if they have the Medicare also, some of the medication it won't be subsidized by the government, so that is called the non-PBS one. And the first thing is I don't have the Medicare, so it is the non-PBS. The prescription itself is the private prescription. Okay, in moving forward, it will have the drug name over here. For me it was the ondansetron 8 milligram wafers, that is the ondansetron 8 milligram ODT, oral dispersible one. And after returning the drug name, doctor will write the direction to how to take this medication. Over here it has written one daily, PRN means one tablet daily whenever required. Okay, and doctor should write the quantity too. Again, many of the prescription, if it is the handwritten prescription, sometimes doctor won't write the quantity, and sometimes in the dental prescription also they forgot to write the with the antibiotic they forgot to write the quantity. Again, if you can't see all the details, again ring the prescriber, ring the doctor, whoever it is. And second thing, again it is the compulsory thing, like for example if you see the drug and all the details but you can't see the quantity, then how many will you dispense? So there is the question, how many will you dispense? You can't dispense any, you can't randomly give like 5 or 6. So you need to have the quantity number, which is also the main important thing. Everything is important on the script, you need to have all the information in the script. After that there is the repeat, one repeat. That means after getting this one, again I can buy next lot of the medication, but I need to wait for certain period. Like for example, For example, if they have given you the medication for the 30 days, you need to wait for minimum of 21 days. It depends upon the medication too, in the direction too. Okay, for that one I'll make a separate video on that too. Okay, and after that there is the repeat interval. Okay, this is mainly important on something like control drug. Okay, the doctor will write the repeat interval. That means after, if a doctor has written the repeat interval of 10 days, that means within 10 days I can't buy this second lot of this medication, since I have the repeat, but I can't buy. If doctor has written like the 10 days of the repeat interval, on that case I can't buy within 10 days. I need to come after 10 days. Okay, it is mainly important on the DDs drug, like DDs or the acid control drug. It is more important. Okay, and it will write how many item it is on here. And after that there is the signature, doctor name, qualification of the doctor, and signature of the doctor. That is all about the prescription. Okay, it has all the details, and sometimes they will have the scanner. You can directly scan on your scanner, and there will be the two scanners. So if you are starting newly in the pharmacy, you don't need to type everything manually, but sometimes this scanning thing barcode might not be working. On that case you need to you need to put all the details manually. Okay, if you have the scanning thing and it can scan, then you go for that one. It will make your job more easy, but after scanning also you need to see all the details. Okay, this is pretty much all about the prescription. So I have highlighted few of the things that you need to remember, like prescriber number. You need to have all the details, but these are the highlighted thing that sometimes the prescription might miss on the prescription. Okay, as I mentioned, prescriber number, sometimes address also, sometimes address of the patient. Sometimes you might not have if it is the handwritten, sometimes the date of the prescription is missing, and sometimes the quantity of the medication, sometimes date of birth of the patient, and sometimes if it is like a scam, someone is doing the scam on the prescription, someone has stole the prescription from the doctor and they are writing themselves, then sometimes the signature is missing, sometimes many detail are missing. On that case, if you think like it is the forged one, then just call the doctor, confirm with the doctor, let the patient know that. It will take sometimes, you need to confirm some details with the prescriber. Okay, and after having these all details, and since the prescription has the one repeat on this one, as I have shown you, the prescription has the one repeat on this one, the pharmacist will tear this page. After dispensing, they will tear this page, and for this Medicare copy they need to put this for the Medicare. Okay, they will put this separately. They will provide you with this one, and on top of this there will be the yellow page, that is the repeat copy for the next time. Okay, from for the next time also don't come with the single copy, because every time there should be the two copies of the prescription. As I mentioned at first also, there were two copy after dispensing, and since it has the one repeat on that one, after that also you will have the, on top of this you will have the yellow copy known as the repeat copy for same particular drug. Okay, same drug, and after that they will step not that one, give that back to you, and when you come next time just bring this prescription. And after seeing all the details, and the after seeing all the details, and the pharmacist will proceed through that one. Okay, and it is on the prescription copy, sorry, pharmacist patient copy, on this particular copy, not the Medicare copy. It will have the yellow repeat paper. Okay, again thank you so much for being with me on this video, and thank you for supporting me on my all the videos. Hopefully I will bring a new video again, and till then just stay safe, stay healthy. Thank you so much, and subscribe to my channel.